9 early signs of stroke in seniors. Don't ignore these warnings. A stroke can change your life in an instant. But the truth is, your body often gives you warnings. The problem? Most people don't recognize them. Today, we'll uncover the 9 early warning signs of stroke after 60 that you should never ignore. So stay tuned. Before we dive into our topic, let's take a moment to acknowledge that every senior is unique. Aging is just a number. While some seniors might experience these warning signs, others may not. It's all about being aware and proactive when it comes to our health. Number 1. Sudden numbness or weakness, especially one side of the body. Imagine you're going about your daily routine and suddenly you feel a tingling or numbness on one side of your body, perhaps the left side. At first, you think it's no big deal. It happens to me all the time. I just shake it off and carry on. But what if it's more than just a passing sensation? What if it's an early warning sign of something serious? Numbness in the face, arm, or leg, particularly on one side, could be the most common and serious early sign of a stroke. A stroke occurs when the blood supply to a part of the brain is interrupted, depriving brain cells of oxygen and nutrients. When this happens, brain cells begin to die within minutes. The sooner treatment is initiated, the better the chances of minimizing brain damage and preventing long-term disability. Number 2. Confusion or trouble speaking. Picture this. Your loved one is trying to tell you something important, but their words are jumbled and they seem confused. You try to understand them, but it's like a foreign language. You ask them to repeat themselves, but the words just don't make sense. In those moments, you realize this is not just a quirky speech pattern. It could be something serious. This might be a sudden change. They were fine just a moment ago. This is no longer cute. It could be an emergency. Slurred speech, inability to form words, or difficulty understanding others can come on suddenly and be very alarming. It's crucial to recognize this as a potential stroke warning sign, especially when it persists. Don't hesitate to call for help right away. Even if the symptoms go away, it's still essential to seek medical attention. Number 3. Sudden vision problems. You're enjoying a lovely day when you notice something unusual. It started subtly, maybe a blurriness in your vision or a persistent floaters in your eyes. At first, you brush it off as needing a break from your reading glasses or too much screen time. But then the unease creeps in. It doesn't go away. And now you see double, like there are 2 images where there should be one. Or worse, everything is dark as night in one or both eyes. This is no ordinary vision issue. It's a glaring signal that something isn't right. So it's time to heed the warning signs. Sudden vision problems, especially when they strike without warning, could be a critical early sign of stroke. It's essential to take immediate action if you or someone you know experiences such symptoms. Don't wait, don't delay. Dial for help. No. 4. Dizziness, loss of balance, or lack of coordination. Picture yourself standing up from your chair and you feel woozy, like the room is spinning around you. You try to walk, but your legs feel shaky and uncoordinated. Perhaps you stumble and almost fall. At first, you rationalize it as feeling a little off balance because you haven't been feeling well lately. But as the disorientation persists, a chilling thought crosses your mind. I don't feel right. Am I having a stroke? That's exactly what you need to consider. Dizziness, loss of balance, or lack of coordination can be an early warning sign of a stroke, especially in older adults. So if you or someone you care about experiences these symptoms, don't dismiss them as minor issues. Seek medical attention promptly. Number 5. Sudden severe headache, no known cause. Suddenly a pain like no other grips your head. It's not the kind of headache you've dealt with before. This one is different, more severe, more intense. Nothing you've tried before seems to help. And as the pain reaches a crescendo, you wonder what's really going on. Could this be something serious? In some cases, this sudden, intense headache can be a sign of a hemorrhagic stroke, also known as a bleeding in the brain. Hemorrhagic strokes occur when a blood vessel in the brain ruptures, causing blood to pool in the brain tissue and increasing pressure on the brain. As the blood accumulates, it exerts pressure on brain cells, damaging them and disrupting their function. This can lead to a range of symptoms, including the sudden severe headache. Number 6. Facial drooping. Have you ever noticed one side of your face seems to droop or sag? It's subtle, but you can't help but wonder, is it just me or is my face uneven? When this happens during a stroke, it's called facial nerve palsy. It affects the muscles of the face, causing one side to droop or become paralyzed. You might even find it challenging to smile, and when you do, the smile may appear lopsided. This unsettling facial distortion isn't just a cause for concern. It's a potential red flag indicating a stroke warning. If you or someone you know notices facial drooping, it's crucial to act fast and seek immediate medical attention. Time is of the essence in these situations. Number 7. Arm weakness. Imagine reaching out to grab a glass of water and you notice your arm suddenly feels heavy and weak. You try to shrug it off, chalking it up to tiredness. But as you attempt to lift the glass, you realize it's not just fatigue. Your arm lacks strength, and there's a disturbing feeling of heaviness on one side of your body. This isn't a figment of your imagination. It could be a concerning sign of a stroke. During a stroke, brain cells responsible for controlling movement are affected. This can lead to muscle weakness or paralysis, often on one side of the body. The affected arm might feel heavy and difficult to move. It's crucial to pay attention to such symptoms and seek medical help promptly. Remember, early intervention can make all the difference. Number 8. Speech difficulties, slurred or strange speech. Communication is central to our daily lives, and when we're able to express ourselves smoothly, we take it for granted. But imagine if you've been attempting to convey something important to someone and your words come out jumbled and distorted. You know what you want to say, but it's coming out as a jumbled mess. Despite your best efforts to articulate your thoughts, the words just won't form properly. Even worse, you might hear yourself speaking and suddenly realize that your speech has taken on a strange quality. It's slow and labored, as if you're struggling to find the right words. This disconcerting realization can be alarming. Fortunately, there are ways to manage and overcome these challenges, but it's vital to address them promptly, especially when it comes to our health. Even brief instances of speech difficulties, garbled words, or inability to form sentences can be an urgent sign of a stroke. Don't overlook these symptoms. Act fast and seek help immediately. Number 9. Sudden fatigue or mental fog. We've all had days where we wake up feeling drained and fatigued. But what if the exhaustion hits you without any warning and it's accompanied by a puzzling mental fog? You find it hard to concentrate or make decisions. Simple tasks require extra effort, and it's not clear why. It's like there's a weight pulling you down. You know you haven't been feeling your usual self for a while, and this feeling of general unwellness has been lingering. But now it's intensifying. Something feels off, and you can't quite put your finger on it. In some cases, this inexplicable fatigue or mental fog could be an early warning sign of a stroke. This less-known symptom highlights the complexity of stroke recognition. What to do if you notice these signs? Remember the acronym FAST. F. Face drooping. A. Arm weakness. S. Speech difficulty. T. Time to call emergency services immediately. Every second counts when dealing with a stroke. Early treatment not only increases the chances of recovery, but also minimizes the potential for permanent damage. In conclusion, strokes are serious medical emergencies that demand immediate attention. By recognizing the early warning signs, we can act quickly and potentially prevent or minimize the severity of a stroke. If you suspect a stroke is happening, don't hesitate to call emergency services. Remember, speed is crucial. The faster medical help is sought, the better the outcome is likely to be. Stay vigilant, stay informed, and stay proactive about your health and the health of your loved ones. We hope this video has been helpful. Please like, share, and subscribe to our channel for more health tips and guides. Stay healthy and keep learning.